Hi, I'm Christian Gittersnaki, CEO of Health Insurance Answers. We're a patient advocate firm that helps patients navigate the healthcare system. So an HMO versus a PPO insurance plan for a patient is vastly different. In healthcare, we love acronyms, right? So what is a HMO? What is a PPO? What does it even mean, right? We just kind of throw these terms around, these acronyms around all the time in healthcare. So patients think they're interchangeable, and they're really not. So an HMO is a health maintenance organization, and a PPO is a preferred provider organization. And it can be worded a little different too, but that's basically what it is, okay? So what the heck does that mean, right? You got a health maintenance, preferred provider. I mean, it's all health insurance, right? Well, it's really not. So the benefits that are associated with each are hugely different, and they work very different for patients. So to kind of make this, to simplify this topic, an HMO is typically a lower cost premium. It's lower out-of-pocket costs, which sounds great, right? The problem is it has a very restricted network of providers you can go to, okay? That provider pool that you want to pick from is much smaller than in a PPO setting. So a PPO typically has deductibles, has higher out-of-pocket costs for copays and coinsurance. But the benefit of a PPO plan is that it opens that network out immensely. And some of them are national networks, right? So you can be back visiting a relative in Chicago, have no worries that you're going to be able to go to a doctor there, okay? That provider pool is huge versus an HMO plan. So that's really the big difference. Patients just have to decide, my employer offers both an HMO and a PPO. The PPO is going to be more expensive every time. It's going to be a little bit more expensive because that network of providers is huge. The other big difference is an HMO has a lot of rules, and the PPO is much more relaxed on rules, right? Where you go, who you want to see. I want to go straight to a specialist. You can do that in a PPO plan. You cannot do that in an HMO plan. It always gets directed back to that hub of care, which is your primary care physician. PPO plan allows the patient to really determine and drive their healthcare experience a little bit more. If you sprained your ankle, you're probably going to want to see a podiatrist, right? Not a primary care. Well, PPO, you can do that. HMO, you can't. Yeah, a local one here would be Health Plan of Nevada. They started off as an HMO, and they're still an HMO. Their HPN product is an HMO-based product. Most of the commercial payers now have them. Cigna has them, Aetna has them, Humana has them. They all offer an HMO line. So an HMO plan is typically about 60 to 70% of a full PPO plan, okay, in cost. So if you're paying $1,000 for a PPO, you're going to pay $600 to $700 for that comparable HMO plan. When debating on what you want, I always like to say, if you're healthy, HMO. Okay, if you have more ongoing issues and you really want the best expertise in care, you want to go to UCLA, and you live in Nevada, you get a PPO plan. So, like I said, HMOs work really well if you're healthy. One of the challenges with an HMO is the referral process, right? A PPO, your doctor, you go to your primary care, and the primary care says, you know what, I need you to see an ophthalmologist or an optometrist. Boom, you go. You can call, you can schedule it, not a problem. On an HMO, right, that's what it is, health maintenance organization. They're gonna tell you when you can go. Well, you need a referral for that with an HMO, and a PPO you don't. So they have to call your HMO provider, the insurance carrier, get an approval. Once the approval is set, then they have to try and get you scheduled with a specific provider. Well, the problem with HMOs, and this has been the experience with patients over the last couple of decades, is that they may have to wait a month, 3 months, 6 months, just to get in the door. That's not great when you're having an issue with your health, right? I mean, if it's not serious, not a big deal, but if it is serious and you're waiting a week for a referral or 2 weeks for a referral and a prior authorization to be done, right? That can be a life or death situation for people. And so a lot of times the patients feel like, well, I'm just sort of at the mercy of this HMO, right? There's not a lot I can do. There is. So a patient can, if they find they're getting the runaround, they should call the liaison at the HMO insurance company. And that's what they're called. They're called provider liaisons. And you can talk to one as a patient or a provider. And so these liaisons are assigned to providers' offices to try and help that whole process work better. The problem is the process itself is there's a lot of red tape, right? When you're talking about referrals, and we have to get a prior authorization before we'll even send you to have your eyes looked at, right? And then you go there, you're going to have to have another prior authorization, maybe for testing, and another prior authorization for treatment and surgery. So this really bogs that system down. So something that should take a week to 10 days can stretch out over the course of many months in an HMO environment. As a PPO plan participant, they're backed up for a month and a half, go to another provider, right? You can call the carrier back and they'll give you a list of available providers. You can choose any of them. The HMO, you have to go back to the HMO and say, you know what, it's a 6 weeks wait. I can't wait that long. I'm not willing to wait that long. And that is something that patients can do, and a lot of times, again, they get intimidated and they feel like, well, it's 6 weeks. What am I going to do? I don't know anybody at the provider's office to get me in earlier. And I tried to schedule somewhere else. They won't take me because my HMO says you have to go to this doctor. And so I think that's a big part of trying to figure out how to navigate that, right? That's where we as like advocates come in and just assist patients with that. Say this is not going to be an acceptable answer or solution to your problem. But the patients they can call the HMO and say, look, I'm not willing to wait 6 weeks. Send me somewhere else. I need you to authorize me to go somewhere else. And they will. Most of the time they will give you 2 or 3 or 4 options. I mean, you know, the liaisons at the insurance companies are in place to help assist. The problem is, again, you're looking at an employee who's employed by who? The insurance company, right? They're not experts on navigating the system. They're just there as an assistant to try and help. But most of the time they have very little power in doing that. And that's why, like, you know, like myself, like as an advocate for a patient, you know, somebody has to treat that patient like it's a family member, okay? And a kind of a nameless big corporation insurance carrier who's answering to stockholders and shareholders every quarter is not that advocate for them. They're just not, right? They're kind of a number because the volume of patients and bills that go through those places would blow your mind, you know, essentially. And I think you brought up a great point too about end of the year, right? You're like, oh, I want to try and get this in by the end of the year. Well, why did you do that? I mean, most patients try and get all of their care done. If they have to get care done, it's like, okay, let me try and get as much done this year as I can, because they have a deductible and out-of-pocket costs, right? And if you have even a $5,000 deductible, and you hit it in, say, September or October, you sure as heck don't want to wait until January 1 when it resets and start this whole process all over, right? You want to get as much care as you can done at that time. And so that's, you know, another aspect that patients, and it is a strategy, okay? It's a strategy that patients should use, is like, you know, don't get put off, don't get pushed off till the new year clicks over, and then you're stuck paying a new deductible again. You know, an HMO versus a PPO plan have a couple different factors. HMOs are typically cheaper out of pocket. They have a much more restricted covenant on the providers that patients can access. But overall, the premiums are lower, the out-of-pocket is lower, and typically they either come with low or no deductible policies for patients. I usually say get an HMO if you're healthy or relatively healthy. PPO, on the other hand, has a vast network of providers. You can really drive your care in any direction you want. You can go out of state. You don't need approvals and referrals to go to the doctors of your choice, but they do come with a higher price tag in their premium costs and out-of-pocket costs, and they do typically come with, and sadly, year after year, higher and higher deductibles.